Infection prevention is a crucial aspect of healthcare delivery. Healthcare workers are at high risk of contracting infections due to their constant exposure to patients with various illnesses. Therefore, it is essential for healthcare workers to understand the importance of infection prevention and control measures. Infection prevention helps to reduce the spread of infectious disease in healthcare settings, which can lead to better patient outcomes and reduce healthcare costs. It also helps protect healthcare workers from contracting infections, which can affect their health and ability to provide care. Healthcare workers must adhere to strict infection control protocols such as hand hygiene, wearing personal protective equipment, and proper disposal of contaminated materials. Failure to comply with these protocols can result in the spread of infections among patients and staff. Every day, healthcare workers are exposed to potential infection. The Centers for Disease Control and Prevention, or CDC, estimates that nearly 2 million healthcare workers become ill from infections each year, including approximately 50,000 workers whose illnesses are caused by antibiotic-resistant bacteria. To combat this threat, the CDC has promoted the use of the 5 Moments for Hand Hygiene initiative to educate health workers about the best practices for preventing the spread of infections. In this essay, I will explain the components of this initiative and discuss the importance of infection prevention for healthcare workers. The first step in implementing the 5 moments for hand hygiene is to ensure that healthcare workers wash their hands with soap and water for a minimum of 20 seconds. This precaution is especially important when handling potentially contaminated materials such as blood or body fluids. Hand washing also should be conducted before and after direct contact with patients using the recommended technique for each situation. The second step in the 5 moments for hand hygiene involves drying hands completely after washing them. This is important because wet hands can spread germs to other surfaces, increasing the risk of infection for both workers and patients. The third step of the 5 moments for hand hygiene involves wearing gloves to prevent contamination while caring for patients who are sick. Gloves can also help prevent the transmission of dangerous diseases from one patient to another. The 6 steps of the 5 moments for hand hygiene represent the fundamentals of effective infection prevention. Practicing good hygiene is one of the most important steps you can take to keep yourself and others healthy. According to Dr. Tedros Adhanom Ghebreyesus, WHO Director General, no country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe. WHO Health Workers Safety Charter is a step towards ensuring that healthcare workers have the safe working conditions, the training, the pay, the respect they deserve. Additionally, the pandemic has also revealed how important it is to protect health workers in order to maintain a functional health system and society. Infection control is the number one obligation for any healthcare worker in any field at any time. All persons that enter a hospital should walk in with confidence, knowing they will be treated without any risk of acquiring a nosocomial infection during their visit. The only way to accurately ensure that this will happen is if all medical personnel follow through with proper usage of their personal protective equipment, commonly known as PPE. PPEs are part of standard precautions, which are components of the guidelines created to guard patients, as well as healthcare workers against job-related exposure and non-zoonotic infections. They supply a bodily barrier between the user and infectious agent. Droplet transmission happens when contaminated pathogenic microorganisms are placed in the air by a person that is infected by ways such as coughing, sneezing, talking, or any other form of droplets from eyes, nose, or mouth or ears. Examples of Example of types of droplet-transmitted diseases are influenza, rubella, mumps, whooping cough, scarlet fever, and most cases of pneumonia. The third way to transmit an infectious disease is by contact. This is the most commonly known transmission. However, most do not know that there are two types, direct and indirect. Direct contact only occurs when an uninfected person actually touches or has direct contact with an infected person's body part or surface. Indirect contact is when an uninfected person touches an object that has become contaminated. Studies show that these types of infections are happening way more than they should. Developed countries are showing statistics of 1 out of every 10 patients are at risk of obtaining a healthcare-associated disease, and this could possibly be 20 times greater in developing countries. This poses a question to many healthcare workers. How can we help stop the spread of infectious disease, especially in the hospital setting? Besides hand washing, which is considered to be the best way to prevent the spread of disease, the next best way is to properly and accurately use the PPEs. There are several different PPEs, for instance, gloves, gowns, aprons, masks, goggles, visors, and caps. Each one of these holds a specific purpose and protects us from different things. When a patient has been diagnosed with disease or infection, there are a specific set of PPEs that are to be used every time a healthcare worker comes into contact with them. For example, if a patient has a droplet-transmitted infection, typhoid, influenza, Ebola, or hepatitis A, the required PPEs are fluid shield masks with a visor, a gown, and a mask. This protects the healthcare worker from contracting the disease and contaminating another patient. Proper usage of PPEs will also protect the patient from contracting a disease that the healthcare worker picked up from another nearby patient. In conclusion, infection prevention is critical for the safety and well-being of both patients and healthcare workers. By following proper infection control measures, we can ensure that our healthcare facilities remain safe places for healing and recovery.